So what was cool was I ended up feeling that her masseter muscle, which is one of the muscles of mastication around the jaw, on the side where she was having this really interesting muscle twitch going on, was extremely enlarged in comparison to this.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Rachel Reynolds, the founder of Refresh Aesthetics in Delaware, who's a dual board-certified nurse practitioner with years of experience in neurotoxin and facial filler injections. She began her journey into facial aesthetics as the first NP on the East Coast to specialize in minimally invasive TMJ treatment, developing an in-depth knowledge of facial anatomy that enhances her facial analysis and treatment planning. Rachel is also a published author of a research article on the use of Wharton's jelly, a regenerative tissue product for TMJ therapy, bringing a high level of expertise in regenerative medicine to her aesthetic work. With advanced training in natural regenerative aesthetics and patented injection techniques learned both nationally and internationally, she's committed to delivering refined, natural-looking results. So Rachel, welcome and glad to have you here.
Thank you so much for having me. I'm so excited.
Yeah, so let's dive right into it. How did you get interested in medicine in the first place?
So I knew that I always wanted to do something medically based. I loved biology when I was in high school. It was my strongest subject for sure. And going into school, I actually originally was thinking I was going to do dental school. And as I was going into it and I was doing my clinicals, because when you're looking to do dental school, a lot of times they'll have you do shadowing. So I did a lot of shadowing and I was kind of like, I don't really feel like this is like me. It doesn't really fit my personality. I can't really get into knowing people with hands in the mouth type of thing. So I definitely realized that I wanted to do something more medically based than dental based kind of early on. And my grandmother was a nurse and my mom kind of pulled me aside and was like, this might be for you. This might be something that you might want to try. And I was like, all right, let's give it a whirl. So I got into nursing school and it was the best experience. I loved it. And I knew as I was going on in nursing school that I really wanted to be a provider. So I went on to NP school, and that's kind of how I ended up in the medical world. And I do love it. It's challenging, but it's so interesting and it evolves all the time. And you get that interaction with individuals that you really get to connect with them. So I just love it.
Okay. And in the introduction, you talked about you being an expert in TMJ. Can you
Mhm.
explain what that is and how did you get into that very specific niche?
Yeah, it was not something that I was honestly anticipating. So TMJ stands for temporomandibular joint, and so that's the part of the jaw joint right here. So I got into it after I moved down to Delaware and I completed a fellowship after I got out of NP school. And that fellowship was focused on primary care. And as I got wrapped up with that, I kind of thought, I might want something that's a little bit more specialty based. So I was looking around and there was a practice nearby that was hiring for a nurse practitioner and they hadn't had a nurse practitioner on before. And I was working with some dentists, which was kind of funny because of my previous background of wanting to do dental. So I was like, oh, this is kind of cool. It's like mixing the things that I wanted to do with my life. So I got into that and I did that for about 3 years. And it was a lot of learning curve because there's not a lot of dental things that you learn in NP school. You learn a basic minimum amount, but I really delved into learning facial anatomy, facial muscles. Of course, Botox is a very common treatment for patients who are having issues with TMJ. It's not the only treatment, nor is it really like the best treatment, in my opinion, if you have true jaw joint breakdown. But if you're just having muscle flare-ups, it's an amazing treatment. But that's kind of how I got into doing aesthetics and doing Botox in particular, was while I was learning all these different elements of the TMJ. So I kind of started bridging into that. And that's how I got into regenerative medicine because dentists actually are very forward thinking when it comes to different regenerative treatments that are available. They've been using it for a really long time. And so I was really excited that I kind of got to be one of the first people to do a lot of different types of jaw joint injections as a nurse practitioner. But I also got to learn a lot of different regenerative treatments well before they were even popular in aesthetic practice. So, for instance, there's something called Easy Gel, which is a very, very popular treatment in aesthetics right now. And what that is it's basically people getting their blood drawn up. You centrifuge it up, so you spin it up, and then you draw out the platelets from the top, like it's the area on the top that gets separated. And then you basically heat that up to make a gel, more or less. So that's something that people are using in aesthetics. It works beautifully for like the under eye area. It works really well for other elements of the face. But dentists have been using that for a while when it comes to using it in like dental implants, because they were using it to kind of help with the dental implants it being accepted more easily into the tissue, the gum tissue. So they've been using that for a while there. And I've been using it for over 3 years now for the jaw joint. So we used it to help regenerate tissue inside of the jaw joint and to promote healing. So it's something where I've had like a really heavy background in that for a while. And so it's so exciting to see aesthetics starting to utilize a lot of these things that I've been super passionate about and kind of melding my worlds together here.
Yeah, you actually come from a very interesting background, coming from the regenerative medicine background into aesthetics. Like I'm starting to
Yeah,
see more and more,
it's different. Yeah,
yeah,
a lot of people do that.
yeah, I'm starting to see more and more people start to bring in regenerative medicine into their aesthetic practice, but most of them started aesthetics and then brought in the regenerative medicine side. But you came in from the opposite way, the regenerative medicine, and then bring that into the aesthetic side.
Yeah, it's cool.
So how did you decide to move into the aesthetic side then?
Yeah, so we started kind of using a lot of these different elements at the clinic that I was at for aesthetics. And because a lot of my patients would be like, "Hey, if you're putting it here, can you put it over here too? Like, can you use some of this tox that you've left over here to put in my face?" And I was like, "Sure." And then as I started to learn more and more about using like the regenerative aspect of like the easy gel, they also call it biofiller. Like most of the dental community calls it biofiller, but it's also known as easy gel in the aesthetic community. So I started learning about how to use it, and a lot of my patients are amazing and super sweet and trusting, and they're like, "Yeah, try it out. Let's see what happens." Like, I want to know, I want to try it. So, I had some patients who were really super excited about trying a non-filler based product, like an all natural based product. So I started kind of using that more and more, and then I started just kind of working that into more of like a med spa type of atmosphere with my patients, and started doing that more and more and having more patients follow up for me for that stuff. And I was like, okay, maybe this is something that I should really branch off into and look into, because I really was enjoying it a lot and loved it a lot and found it super rewarding. And just people are so kind and sweet, and they really want different options for things. And I feel like because of my like kind of crazy background, I can give them sort of a different perspective on how to approach stuff. So it's been really honoring and flattering to get to do this. But that's kind of how I bridged into it, was just slowly working with people, slowly, learning different ways that we can use some of these other things that we're utilizing for the jaw joint into aesthetics, and just kind of melded into there. So
Got it. Now, for people that don't know what regenerative medicine is, would you mind giving just like a quick fifth grade level, what is regenerative medicine and what are the benefits, what's the real benefits of it as well?
yeah. So there's a lot of different elements of what's considered like regenerative medicine. It's more or less anything that's promoting your body to produce collagen and healing. So a lot of different things in aesthetics have been around for a while that can do that. Like there's a lot of biostimulants out there that people know of, like Sculptra, Radias. Those are more to do with trying to promote the body to heal or to regenerate tissue versus just doing like filler, hyaluronic acid based filler. What that is, I mean, that is a property that we have in our skin. However, what that really is doing is it's going under the skin and it's just putting a bunch of volume under the skin to kind of help support areas of volume loss, which can be great. And there's some patients that really do need that. But there's a big movement that's been going on lately where people are wanting to go more towards the natural. They really want to look more at like themselves, but just a little bit younger or just a little bit better. So that is where regenerative medicine really does shine because it doesn't really change the look of your face very much. It just helps support the collagen and helps to support your skin texture. And it really helps to produce areas that needs healing. It promotes that in those areas. So it's wonderful for trying to help with like acne scarring, or if there's some areas where there's just a little bit more depletion, like I was talking about the under eye, works great. And I would argue that it works better than filler in the under eye because it just really gives such a natural look. Filler in the under eye often has a lot of complications where it can move very easily. The skin is very thin, so you can kind of see the filler sometimes very easily. So that's where like Easy Gel does a great job. And biostimulants like Sculptra and Radiesse do an amazing job to try to help with areas of depletion, such as the temple area here often kind of gets scooped in as we age. If we want to try to help regenerate any of these areas around the cheek area, that helps a lot with it too. So it takes time to see the results of it. It takes usually a couple of months versus filler, of course, is like instantaneous. But the long-term effects are really usually what's better with regenerative medicine, if that makes sense. Did that answer your question? I hope
Yes,
so.
it definitely did. So,
Okay.
and do you get people that come in, like your clients, your patients, who understand what regenerative medicine, what the benefits are, or do you find that you really have to walk them through, hey, this is why you want to do this, this is how it's different from filler, or how you can complement with filler? Like, what's been most of the situations that you found?
Yeah, I would say it's kind of a 50-50 split. I get some people who come in who there's a lot of people who hear online about like pillow face, which there's a big thing with that where people have gotten like overfilled and the filler has migrated. And so there's a lot of people who kind of have heard that catchphrase online and they're like, I really want to avoid that. I'm scared of that happening to me. How can I avoid that? Are there other options that I can have? So they're already like kind of thinking in that mindset of like, I want something different. So it's not such a big leap for a lot of these people to say like, hey, there is another option and it doesn't have the same risks like the filler does. So those people are usually super easy to talk to about it, really open about it. But I do have some patients who are like, no, I've gotten filler for X amount of years. That's my go-to. I really don't want something else. I'm like, all right, that's fine. So, but usually people I feel like are leaning more towards the natural options these days. I feel like that's kind of the big movement that's coming through with aesthetic medicine is regenerative products. Lasers are getting huge. People love their laser outcomes, and that's also an element of regenerative medicine because it's stimulating the body to heal, to regenerate. So, a
Okay.
lot of good things out there for it.
Now, I'm sure that the people that come in also have maybe certain myths or misconceptions that they believe they're just not right. Or, I mean, what are some of those common misconceptions that you hear the most often from people?
I guess that's a good question. I think because regenerative medicine is so new, there's a lot of misconception that it doesn't work. So I've had to kind of have that talk with a few people that, I'm sure there's people out there who haven't seen the results that maybe they've wanted out of it. But that's usually because sometimes these treatments that in regenerative medicine take a couple of rounds to get the results that you want out of them. So I think that's usually the biggest thing that I have to talk about with patients is that you have to be ready to commit. You have to be ready to really invest in it, and then you're going to see the results of it for the long term, and you're going to get the most efficacy out of the treatment. So it's not that it doesn't work, it's that typically it's just the patients haven't completed the amount of treatments that they usually need to get the full benefit from it.
Okay. Now, I know with the regenerative medicine, since you've had more of a background in regenerative medicine, I know that for a while in the beginning, the FDA really did not like regenerative medicine at all.
Mhm.
Like they were trying to shut down practices and like really try and kill it. And what do you think really led it to that what it was before, where they're trying to squash it, to now it's starting to become more and more recognized? The FDA is starting to loosen up a little bit more. Like, what do you think were the key factors that led to that transformation?
Yeah, that's a good question. I think there's a lot of elements in aesthetics where we're using things off label, right? Like there's a lot of things that we do in aesthetics that are off label, even like toxin, like putting Botox in certain areas of the face is considered off label still. So there's a lot of things that we do that will show great results and that the patients love it and then they kind of are talking about it and you get sort of this like societal push for this when you see those great results. So I think it's just us people in aesthetics doing what we do, which is trying things out in a safe way, but trying things out differently and showing the efficacy behind it and having the patients who've had those beneficial results really pushing for it and saying, this is amazing. I'm seeing these results and I am loving it and having other people want it. And I think that kind of puts the pressure sometimes on the FDA to say, maybe we should take a look at this and see what's going on here. And, because I did a study, like you talked about in the beginning, I did a study on a regenerative tissue, Wharton's jelly, and that's one where we had to work with the IRB on it. And so I was doing jaw joint injections, which is considered off-label usage for that. That tissue did have some FDA approval for other areas of the body for injections, but it didn't have it yet for the jaw joint. So that really kind of helped to propel some other tissue regenerative injections for the FDA to kind of take a look at inside of the jaw joint. So I think it's just us all using these things that show great regenerative properties for patients and just kind of being like, hey, this is working. Like, we should look at this. We should do a study. We should do, look at what these patients are saying, even if it's anecdotal, and just kind of keep showing what we're seeing. So I think that's kind of where it came in. The FDA is always very nervous, especially when it comes to regenerative things, because I think they were scared of some of these properties in patients. I sometimes will get the question too of like, if it's stimulating collagen, could it potentially like increase risk of cancer because it's causing more like cell proliferation in some ways. And so I kind of suspect that might have also been a little bit of some of the FDA's hesitancy with some of it as well. So they're always trying to look out for the patient, of course, too. But there's some people who really do benefit from these, and there's really no evidence that any of these things like stimulate any sort of cancer problems for individuals from any studies that I've read. So I think we're doing pretty good on that.
Good to hear. Now, I do want to dive deeper into the product that you use and really the importance of people to understand, is it good product? Are practices using good product, not good product?
Yeah.
Things along those lines. Because I've heard stories of people going and like going to a practice, like it's really in someone's garage or their
Yeah.
backyard, and like it's super cheap, and that's why they go there. And I mean, what would be your advice to people so that they understand the difference between, okay, is understanding where they source the product from important on the aesthetic side, and also on the regenerative medicine side, like how important is that as well?
Yeah, it's a really, really good question. So, biostimulants like Radiesse and Sculptra, that's easy because it comes right from the manufacturer. So, that has all gone through a really intense process of the sterility and the process of making it and the packaging and everything with that. You should be in the clear for that as long as they are getting it from the correct source. So as long as they're not buying it off label online from some like scary place, you can always ask your injector too to like show you the packaging, and it'll say on the back usually where it was manufactured, and it'll show you like a serial number. So as long as they can kind of show you the packaging, you usually are in the clear for the biostimulants. What gets tricky is a lot of people are using like exosomes nowadays, and I use exosomes as well. Exosomes is a property that is in regenerative tissue, like Wharton's jelly. So I'm going to get in the nitty gritty here for a second, just so you can kind of understand. So exosomes usually is derived from different areas in the body. The main places that it's typically derived from, usually for most people, is either mesenchymal cells, like stem cells, or it can be coming from placental tissue, or it can be coming from like platelet derived. So that's kind of like where they take people's blood and then they take a big amount of it, and then they basically try and extract exosomes from a person's blood, because we all have exosomes in our blood. What an exosome is a cell. It's basically like a cell messenger. So you can kind of think about like a little like cell sending off a text message to another cell and saying, hey, to this other cell, we need some help over here. We're having some issues with X, Y, and Z. And then that helps to bring in sort of the service that's needed into that tissue region. So exosomes have been really popular lately because what they can do is they can stimulate areas of the skin to say, hey, we need to heal. So people are using them a lot after laser treatments, after microneedling. They're actually microneedling. Some people are microneedling it into the skin and getting great results with that. So how do we know that that's a good exosome product? Because there's no real one company that's selling exosomes that's saying like, hey, we're a gold standard company. The way that you should know is, you should be able to talk to well, as an injector, if you're buying the exosome, you need to be able to talk to the individuals and see what their lab looks like. The exosome company that I get mine from, I've actually physically seen their lab. That's up, it's not too far from here. It's like 45 minutes up near Philadelphia. And you should be able to understand how it is that they're actually producing the product, what the tissue, where the tissue is from, how they're sourcing that tissue in. So you can tell your patients why it's safe, how it's safe, what's being made here, and how is it being made. So you really kind of need to source it a little bit yourself. But I feel like if you just kind of take those extra steps, you can really ensure the quality of what's being given to you in a lot of these different products. Does that kind of answer your question a little bit?
Yeah, that does.
Okay.
So then the next step then is that what would you, how, or I guess, how would you recommend to people to find the right provider or injector to that would be the good fit for their situation? Like what would you advise them like if they're looking for someone?
I would say I would call and I would ask them what kind of different regenerative property medicine things that they have in the office, and ask them, do you guys specialize in anything with that? And if they kind of just give like a blanket answer of like, yes, we specialize in everything, I mean, that might not be true, just because like who can specialize in all of these things, especially when they're so new and everything, all these different areas of it are coming out. But I would say if you just kind of are able to give the office a call or go to your consultation, and if they're able to explain the why behind what they're doing, and they're able to show you some good before and afters, and also just show you the products that they're using, if they have passion behind what they're doing too, you should be able to kind of feel it. That's really a good way to suss out if someone is more regenerative focused or not, is if they're super excited to talk to you about it, have all this like knowledge that they can explain to you on why it works the way it works, and explaining to you why they have what products they have in the office, because that's a big thing. They should really be able to talk through that.
Okay. Now, Rachel, throughout your experience, I'm sure that you've had some tough cases that have come in through your door. Is there maybe one story that really stands out in your mind, just a tough case, and then how you were able to help them get a great outcome in the end?
Yeah, so I guess for I had a patient who came in probably about a few weeks ago now, or maybe it was over a month ago actually. And she was having some difficulty with a muscle spasm of the face. And it was actually very interesting because she came in, I took some videos of it, and I was talking to a couple of my colleagues about it. And I was like, I really think it's her muscle, like her, what's called her rosaurus muscle, which is the muscle that connects right here to this corner of the mouth. And so it's a hard area to treat because if you end up putting some like Botox in here, and you try and relax that muscle so it's no longer spasming, it can cause them to have an asymmetrical smile. And you don't ever want your patient walking around looking like they had a stroke. So that is why it's kind of a tougher area to treat. And so most of my colleagues did agree. They're like, yeah, I think that's the resource muscle as well. So I had a few people who are like, you should look to rule out X, Y, and Z. I had already actually ruled out any sort of issue with sometimes you think like an electrolyte deficiency. So I'd done like a panel on her, blood work panel. Those all looked good. We were making sure she was doing electrolyte replenishments as well after her runs because she's a runner. And so there was no problems with that. I didn't feel like there was anything neurologic going on. I do have a background as a neurology nurse before I went on for my NP. So I was like, and I worked in primary care before too. So I did a neurology assessment on her. I didn't see any problems with that I was concerned about that needed a referral. And I also have a qualification as a psychiatric nurse practitioner as well. So I'm board certified in that. So I was also kind of trying to rule out if she had like a Tourette's problem, because sometimes patients with Tourette's can have like a tic like that where their muscle is moving. But either way, I didn't think that was what was going on. But even if it is a tic, using Botox sometimes is a really great way to get people who have a Tourette's tic like that to calm down. So either way, I think it was stress induced. So what was cool was I ended up feeling that her masseter muscle, which is one of the muscles of mastication around the jaw, on the side where she was having this really interesting muscle twitch going on, was extremely enlarged in comparison to this side. So it was probably about double, if not three times the size on this side than it was on this side. So what we figured out is that she was favoring this side when she would like clench, grind, chew, and that was causing a lot of the other muscles around the face to be tight, and that was triggering this muscle spasm that she was having. So I was able to actually end up just Botoxing her masseter muscle as well as some of the surrounding muscles around this one. So I was able to avoid giving her a stroke look to get rid of this asymmetry or this problematic muscle spasm that she was having. So, and she's happy as a clam now. She's thrilled with it. And she's realizing now too, she's like, I actually was having headaches on this side. And now I think I'm realizing it was coming from that muscle. I'm like, yeah, that happens a lot. So that was a interesting case where I feel like I was able to pull a lot of my different
Yeah,
backgrounds together.
you used everything in your arsenal.
It's like all over. Yeah, it was cool though. I definitely enjoyed it, and she's a really sweet patient. So
That's great. Now, I'm curious, Rachel, what role do you believe that artistry plays in your approach to patient care? Since I don't think most people think about artistry when it comes to medicine, but what role do you think that it has in what you do in your day to day?
I think it's huge. You really kind of have to really have an artistic eye when you're looking at a patient and be able to look for areas of shadowing. So a lot of times it reminds me of like makeup artist work because you're looking to areas where you're trying to highlight places and also areas where you're trying to work off shadows when you're trying to help define and contour the face more. So that's a big thing. You have to be able to kind of pick up on asymmetry and see what's going on there and how you're going to balance that out as well. So that definitely, I feel like you have to use a lot of artistry for that. And lips, I feel like is such an artistic treatment. You really have to be artsy, and you really do have to kind of have a flair and finesse when you're looking at a person's lip and trying to shape it and sculpt it in a way. So there's a lot of elements of art that go into it that I believe is really huge. So if you want to get into aesthetic medicine, I think you kind of have to enjoy that element of it at least.
Hmm. Now, let's say that you're comparing two injectors or providers. One of them was very strong in the artistic side, but their skill set was average, and yet someone who lacked the artistic eye, but they were very high skill set. Which one do you think would
Do
overall,
better.
yeah, do better? I guess if you had to put it simply.
That's a good question. I mean, I think technique can be taught. I think having an artistic eye is something that's harder to teach personally, because it's something where you have to sort of, I feel like, have a finesse for it. And I don't know if someone who doesn't naturally have that would enjoy trying to learn it, because I feel like it's a hard thing if it doesn't come to you. I feel like it's a harder thing to learn because you have to really feel it and love it as you're doing it and you're sculpting something. Whereas technique, I mean, you can learn techniques and those techniques can help to guide your artistic eye very much so, but I don't know if you can teach the artistic flair as easily. Not to say it can't be done, but I just don't know if you can
A
as
little bit
easily.
harder, a little bit harder.
Yes.
Okay, so then I'm curious, Rachel, for your practice, Refresh Aesthetics, what's your vision for the practice?
Yeah, I really want to focus a lot on, shocker, regenerative medicine. I want to bring a big element of that and trying to help patients to just feel the best that they can for the age that they're at and just meeting people where they're at and where their bodies are at. So that's really where, like I was saying, regenerative medicine shines. It helps to kickstart a lot of those collagen regeneration properties for the face. So I just have a big passion for that, and I really hope that I can continue to do that for the patients that I see. I think so, because people seem to be really happy with it. But I just want to have a safe space, especially for women to come and feel not judged and heard and excited and feel like something that's there for them so that they can feel a little bit better. Because this is something that not everybody necessarily needs, but it's something that can definitely make you feel a whole lot better and really give someone their confidence back when they've been lacking. I had a patient that I saw a couple weeks ago, and she went through cancer treatments. So she just got done with chemo about like a year ago. And so her face, and she's cancer free, which is amazing, but her face really has gotten depleted because of the weight loss that she went through. And just getting her to see some of her volume back in her face brought tears to her eyes. And it was a very moving moment for sure. And, obviously that's not something she needs to be healthy, but it's something that some people do need to feel better. And a lot of times feeling better causes you to also be healthier because you want to take care of yourself. You want to get up and see people and interact and socialize. And that's, from what we know of all these studies, socialization is key. So it's key to long-term happiness.
Yeah, I think you brought up a really good point as far as what your long-term vision is. It's really just to help people get their confidence back. It's not
Mhm.
about trying to maximize their beauty, which
Yeah.
I've heard any provider say like that's the goal, it's to maximize beauty. It's really just to make them feel like their clients and their patients are the best versions of themselves.
Yeah, thank you. That's a good way to round it out. Yeah.
Yeah. Well, Rachel, I have one last question for you, but before I ask it, I do want to point people to your website at refreshaestheticsde.com.
Great.
Now, the last question is, what does beauty mean to you?
Oh, such a deep question. I think beauty to me is feeling happy inside and out. So having a really good connection with who you are and what you want, but also just being excited to wake up in the day and greet people and enjoy the things that you have around you. I think that's what beauty truly is to me.
Okay, well, there you have it. Rachel sharing her expertise. So, Rachel, where can people contact you and your practice?
Sure. So they can contact me directly through the website that you pointed them to, refreshaestheticsde.com. And my office phone number is 607-743-9354 if they're looking to call and book. There's also a link right on my website to book as well, so they can book directly through there.
Awesome. Well, Rachel, it was a pleasure. This is a lot of fun. Thank you for coming on the show and sharing.
Yeah, thanks so much for having me. It was wonderful getting to meet you and chat about all things aesthetics that I love.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.